Thank you, Presiding Officer. How will the Welsh Government protect preventative healthcare measures in the forthcoming budget?
So the Welsh Government remains committed to prevention in healthcare services. Tomorrow, for example, we will add to the repertoire of our standingly successful screening services when the bowel screening programme will be widened to include 51 to 54-year-olds for the first time in Wales.
Thank you for that response, First Minister. There can be no doubt that times are tough for public finances, despite having the best performing economy in the G7. Taxes as a proportion of income have risen to an all-time high. Sadly, the cost of the pandemic, together with government efforts to curb the energy and cost of living crisis, means that UK national debt stands at £2.5 trillion, equivalent to 101% GDP. So hard choices have to be made, which I accept. However, we cannot allow short-term thinking to influence our decisions. Health prevention can save millions in the long term. I am told that one of the programs likely to be cut is the All Wales Diabetes Prevention Programme. First Minister, this programme is working with 14 of the 16 practices involved in the pilot, reporting significantly fewer patients being diagnosed with type 2 diabetes. This work is invaluable and needs to continue. Therefore, First Minister, will you ensure that such programs are protected when it comes to setting next year's budget? Thank you.
I thank the member for the question. I'm afraid I'm not aware of the specific instance to which he referred, but I do agree with the general point that he made, that investment in prevention in the health service repays you back many, many times over. I'll offer just one example of that, Llywydd, because it was, at the time, a matter of controversy here on the floor of the Assembly, as it was then, when we decided to invest in HPV vaccination for young women at that stage. Young women while in school. It was opposed by members on the floor of this Senate. But those young women who were first offered that vaccination are now in their 20s, and the figures are showing that those young women have an 87% lower chance of cervical cancer than an unvaccinated population. That is an absolute illustration of the point that the member made, where that upfront investment in preventative vaccination will have saved the lives of those young women, most importantly of all, but also all the costs that would have gone into the health service in dealing with the consequence of their illness.